And with COVID-19 numbers not consistently going down further and a jittery public, it really came as no surprise today when Premier Doug Ford announced schools will not reopen anywhere in the province in June.
The safety of our children is my top priority. And one thing I will never do is take unnecessary risk when it comes to our children. And that's why, after careful consideration, after consulting with the health experts, it is clear that we cannot open schools at this time.
The current at-home learning will continue, and there will be summer school courses that will have an emphasis on credit recovery and credit accumulation. They can be taken in class or online if students aren't comfortable returning to school in July. And the Premier also announced child care centres will reopen under very strict guidelines during Stage 2 of relaxing restrictions. Stage 1 just began today, and there's no timeline for when Stage 2 will begin, but it will at least be 2 to 4 weeks. Overnight camps will remain closed for the summer, but day camps will be allowed to open. Now, the Education Minister warned that when school does resume in the fall, it's not going to be the same.
When school does resume, presumably in September, do you anticipate having to implement lower class sizes or just having kids come in the mornings and then half of the other school comes in the afternoon? What's on the table? What are you thinking about?
I think fundamentally it includes elements like you've suggested. And, the spacing is going to be critical, but we want to see kids return in September, but we want to do that once we have a program in place. And for families out there, you will know the details. You will know the plan for September by the end of June.
And as we told you off the top of the show, as Janella mentioned, new COVID-19 cases increased by 427 today. That's the highest daily increase since May 8th. The chief medical officer of health says he hopes it's a blip and the result of a data shift. However, the rolling 5-day average has also been increasing moderately this past week. Almost all long-term care homes, staff and residents have now been tested, so he said it would not be surprising if community spread cases go up, as testing has now changed to anyone who has symptoms.